Welcome to the Private Health Insurance Innovation Insights webinar. My name's David Worldon. I am the founder of Accelerated Innovation, which is a boutique management consultancy helping insurers and their partners prepare for the future. Over the past 2 years, we've been lucky enough to save insurance leaders over $1 million in consulting fees, and we have an NPS 4 times that of any major consultancy. I'm also the host of the Innovation Insider podcast, the author of Get Shit Done, which is helping of hundreds of leaders innovate inside complex organizations. If you haven't got a copy of the book, let me know at the end of the call and I'll happily send you a copy for free. Currently working with a number of insurers and their partners to uplift their innovation capability and to prepare for uncertain and a challenging future that we're all living in. And essentially, we are on a mission to save leaders $20 million in fees and 40 years waiting to get things moving inside their organizations. I'm a self-proclaimed insurance nerd. I'm passionate about insurance. It gets me out of bed every morning and gets me excited, as I'm hoping those on the call feel similarly about the industries that they work in. What we're going to cover today is, at a very high level, we're going to talk a little bit about the private health insurance industry in Australia, then cover the factors that are shaping the industry and talk to a little bit of detail around a framework we've got that's sort of 7 drivers of industry that we believe are critical to success. We're going to talk about how the major funds are responding to those drivers. The future of the industry. So we're going to take a sort of 10-year horizon looking what private health insurance might look like and healthcare in Australia might look like in 10 years' time in 2035. We're going to give you the opportunity to benchmark your fund to see how well prepared you are for the current and future of the industry. And then at the very end, I do have an exclusive offer for everyone who has joined the call today, as I like to do. So a very warm welcome to everyone. I might just kick off actually by providing a little bit of context around the private health insurance industry that we are talking about today. And there's no better person to introduce the purpose of the industry than Ben Harris, who is the Director of Policy and Research at Private Healthcare Australia. I'll just play this little clip taken from our podcast recently.
Private health insurance is incredibly important in our health system. It provides a balance. Now, we've had Medicare for 40 years now. It's a really long-running program. It's incredibly popular with consumers and voters, but it relies on a private system to buttress various aspects of it. Private health insurance covers in-hospital care, covers 70% of planned or elective surgery, and it covers a range of other services. Importantly, it provides not only access for some people, but it brings extra money into the health system, which actually improves the equity of our health system. When you've got a health system which only has one funder, like many in Europe or the National Health Service, it's really bad for equity. Now, it's not as bad as the American system. The American system has all sorts of problems. But our highly regulated private health system improves access to healthcare, it improves equity, and it brings additional money into the system.
Thank you, Ben. So a little bit around the current state of private health in Australia, private health insurance. So we're talking about a $31 billion industry that's represented or fought by 28 different health funds. But as you can see here, like many other financial services industries in Australia, the market is dominated by a handful of players with a long tail of competitors fighting for the final 20% of the market. So if you look on the left-hand side of the chart, color-coded by the fund, you've got Bupa, Medibank, HCF, NIB, and HBF representing 79 to 80% of the market with a very long tail covered in purple, largely dominated by member-owned funds across various different sectors, industries, and cohorts of Australians. Participation in private health has increased about 40% over the past 50 years, and you can see that the introduction of Medicare and government sticks and carrots have really caused the most disruption to the industry's stability over this time. So the introduction of Medicare sort of created an immediate decline in the use of and utility of private healthcare. that was sort of, I guess, given a kick in the late 90s, early 2000s with the introduction of government sticks and carrots, primarily the Medicare levy surcharge and lifetime health cover, that created that kind of growth uptick that we are seeing and have seen across the last 25 years or so. If you take a look at the same data but compare it to the percentage of Australians over the same period, what we've seen is that private healthcare's relevance has actually decreased over that same period of time. So although we're seeing more customers choosing private health than ever before, we are seeing, as a percentage of the population, that has actually declined, but somewhat stabilised since the introduction of those services, or those sticks and carrots in the around 25 years ago. So the Medicare levy surcharge and lifetime health cover certainly created a level of stability around private health insurance. But what we're seeing is that insurers are constantly fighting to stay relevant in the system, which is largely something that we're going to sort of talk about today, and some of the things that insurers are doing to remain relevant with consumers and make sure that they're increasingly seeing or continually seeing value through having private health insurance. So having spent a number of years working both inside and alongside private health insurers, we've developed a framework called the PHI Factors that outlines the key drivers shaping the private healthcare system and the private health insurance industry. It's called PHI Factors, with each letter of the word factors representing a significant driver shaping the industry. So I'm just going to talk through a quick outline of what they are today, and this largely shapes what we're going to talk about. So the first is F for financial pressures. So rising premiums, out-of-pocket costs, and affordability challenges are continually eroding the value perception of PHI, placing funds at the centre of scrutiny from consumers, partners, and governments, and often treated as a punching bag. This forces funds to tightly manage their premiums and costs whilst innovating to stay relevant with their consumers and their members. A is for an aging and chronically ill population. So an older population, chronic disease burden and migration patterns are shifting demand and placing increasing pressure on insurers' sustainability. Older and sicker members living for longer are placing enormous strain on claims and forcing insurers to innovate to help members live healthier, recover quicker and sustainably, whilst maintaining value for younger members whom they are dependent on to fund the system and the entire business model. C is for consumer trust and expectations. So with rising demand for transparency, simplicity, and digital-first experiences, this is holding insurers to account. Complex products, hidden surprises, and slow, manual, opaque experiences are no longer tolerated, forcing insurers to invest in digital and transparent experiences with no nasty surprises. T is for technology and digital transformation. AI, virtual care, and interoperable systems are redefining engagement and efficiency. On the front end, consumers are expecting seamless digital experiences whilst ensuring their data is kept safe and secure in the back end. The rise of digital health and AI is also putting more power in the hands of the consumers than ever before, forcing insurers to adapt and invest in new models of health and well-being. O is for organisational sustainability. Policy levers, regulation, and hospital viability are shaping the system's balance. PHI is one of Australia's most regulated industries, placing continued pressure on the ability to innovate. Coupled with hospital workforce shortages, increasing costs of health tech, a strained public and private hospital system, and ESG requirements increasing, the ability to invest in innovation is challenging for insurers at a time when it is needed the most. R is for relationships and power. Shifting dynamics between insurers, hospitals, specialists, governments, and empowered consumers makes system progress challenging. I define the private healthcare ecosystem as a symbiotic circle of mistrust, where hospitals, insurers, governments, and clinicians all need each other to survive, but all publicly hate each other at the same time. These system dynamics create all sorts of tensions and challenges around the ongoing sustainability of private healthcare in Australia, whose role it is to drive meaningful change and invest in innovation to prepare the system, the private healthcare system, for the future. And finally, S is for staying well. So wellness, prevention, and mental health are emerging as critical levers of long-term value. Investing in healthier societies and healthier members yields significant long-term benefits for insurers and consumers, but the long-term return on investment makes it difficult to justify in-year spend on everyday wellbeing initiatives. We're starting to see an increasing amount of investment from insurers into everyday health as other system players are less inclined to. Okay, and then to add a little bit to that, we're going to talk a little bit about what's keeping insurance leaders up at night. So through rigorous research that and conversations that we've had with industry leaders over the past couple of years, and more poignantly towards over the last couple of months, we've asked a number of leaders, what are the things that are keeping them awake at night, and what are the things that are really kind of stressing them out and getting them worried about their organisations? First and foremost is that leaders are unanimous that the health of Australians is the system's greatest test. Chronic conditions drive most claims costs and are rising fast. Insurers are increasingly aware that prevention and long-term health management is the only sustainable path forward. Number two, digital transformation is no longer a differentiator, it is survival. From predictive analytics to virtual care and automated claims, technology is now the foundation for efficiency, experience, and innovation. The challenge is not just building digital tools, but embedding them into workflows, culture, and member interactions so they deliver measurable value. This is particularly challenging for insurers who are struggling to deliver simple digital experiences just to meet the expectations of yesterday before even considering today and the future. The third thing keeping leaders awake is affordability and price sensitivity. Even the best innovations mean little if members can't afford to stay insured. Rising living costs and stagnant wages are forcing Australians to reconsider the value of their cover. Coupled with the fact that health inflation rises faster than most sectors in the economy, and the full costs are rarely passed on or seen by consumers. This places continued pressure on funds and the industry's relevance with consumers. Finally, ageing population and aged care. Australia's ageing population is both a demographic certainty and an economic challenge. More members will need complex, coordinated care that bridges hospital, home, and the community. The risk equalisation pool helps to maintain the viability of the system and many funds, but the combined forces of an older and sicker population, coupled with decreasing relevance for young Australians, puts increased strain on leaders and health funds. So with that in mind, we'll talk about how the major funds are responding. And this is based on some deep research that we've done across the 5 major players that I mentioned before. So this is Medibank, Bupa, NIB, HCF, and HBF, who represent that 80% of the market. What we're taking a look at is kind of high-level themes of how these funds are responding collectively to some of those key system challenges. Number one is that the big shift in 2025 is that affordability is no longer just being handled with temporary fixes. The leading funds are redesigning the cost structure of care rather than relying on smaller premium adjustments. So historically, we know that insurance is a cost plus business, so it's driven by the cost of services, adding a little bit of margin on top to be able to provide the service and then deliver value back to the owners of the businesses. What we're seeing is with that largely controlled and centralised by the government and the inability to actually pass those costs on, insurers are finding other ways to deliver affordability to their members. So things like no gap services, home-based care, value-based partnerships, and digital claims automation. So as some examples, we've seen Medibank invest in the Adelaide private hospital in the past 12 months, which is defined as Australia's first no-gap hospital. HCF delivered 97% no gap or known gap coverage, meaning almost every hospital episode came with no unexpected costs for their members. HBF delivered more than 30,000 fully covered no gap dental and physio visits, and NIB in the last 12 months redesigned their contracting with St Vincent's and other hospitals and hospital providers, shifting more rehab and palliative care into home settings, directly reducing hospital costs. Number two is that prevention is scaling beyond pilots. So we are seeing increased investment into virtual coaching, chronic disease programs, weight management pathways, early detection initiatives, and a genuine shift from being bill payers into health partners. So examples of this, just a handful of examples, is HCF's Heart and Diabetes Health Check that identified elevated risks of heart disease for 72% of screened members. So members that they approached with this particular test, 72% were identified as high risk, helping them better understand their health and find a pathway to better health. So in years gone by, the idea of a health fund doing this sort of screening would have been completely out of scope or completely incomprehensible, but we're seeing an increasing amount of these screening, testing, and health checks happening upstream to help funds better understand their members and then provide more value and healthy pathways for them as preventative measures. We've seen Medibank double their prevention participation to 283,000 members over the past 12 months, with musculoskeletal and metabolic programs tied directly to avoidance of high-cost surgeries. NIB conducted over 100,000 risk screenings in the past 12 months, including melanoma checks, and enrolled 22,000 members in targeted chronic disease programs. And HBF's CSIRO weight program delivered more than 1,000 participants, and their coach program grew over 50% over the past 12 months, supporting older adults to help manage their chronic risk earlier. Number 3 is that virtual and home-based care are reshaping delivery. So virtual care, short stay models, and home-based care aren't necessarily fringe services anymore. These are now mainstream, high-volume delivery channels that reduce pressure on hospitals and improve member experience and preference. Examples include NIB's Midnight Health that supported over 200,000 patients through virtual telehealth consultations in the past 12 months. Medibank delivered 1.4 million virtual consultations and managed 177,000 bed days at home through Amplar Health, and they now have the largest home care footprint in the country. HCF avoided almost 40,000 hospital bed days through treatment at home, covering chemotherapy, IV, antibiotics, and rehab. And Bupa is trialling hospital at home, virtual rehab, and expanded free GP telehealth through their Blue platform to reduce reliance on EDs and GP shortages. So there's no shortage of virtual solutions. Number 4 is digital capability has matured. It's no longer about apps or convenience, but about scaling secure, interoperable platforms that reduce cost, increase accuracy, and improve experience. So you can see here, examples include Bupa modernising its digital platforms and integrating virtual and physical services through Bluer and Connected Care. NIB rolled out more than 50 AI projects over the past 12 months, generating $18 million in productivity savings and improving claims accuracy. And HBF completing its multi-year transformation program, automating claims and upgrading cloud environments to reduce errors and speed up processing. Consumer trust is a long-term weakness in PHI, but 2025 delivered some clear improvements driven by simpler cover, clarity on out-of-pocket costs, and more tangible value for members and customers. HBF's Patient Pulse is an example of this, that empowers patients to hold a mirror up to hospitals and clinicians through post-surgery satisfaction surveys. Medibank recorded its strongest advocacy since 2022 and delivered nearly $33 million savings of benefit through their Live Better rewards, directly offsetting everyday costs for their members. And Bupa expanded free telehealth and made preventative dental and optical free, giving value members can see and feel every day. There's also now a clear maturity gap between leaders and followers, and that is widening. So market leaders have built scale, momentum, and integrated health ecosystems, whilst slower and smaller funds are working hard just to keep up. Some examples of this, some obvious examples, is that Bupa started scaling an integrated provider network, including 18 medical centres and new Mindplace clinics in the past 12 months. They will also offer the first to offer free telehealth consults for their members. And the other big one is that Medibank leads across a number of PHI factors. And the most obvious example is they were able to announce that they're investing $50 million into mental health initiatives over the coming years, but also able to invest in the Adelaide private hospital that I did touch on earlier, as a key no-gap hospital, and potentially something that's going to shift the needle on how care is delivered, or private healthcare is delivered in Australia. So scale is an advantage more so than ever before, with increasing capital flowing into prevention, digital and care redesign. And finally, we're seeing innovation becoming performance, not necessarily a side project. So it has shifted from a collection of pilots to a disciplined operating model tied to measurable outcomes, governance, and accountability. Examples, you've got Medibank, who have embedded innovation into core metrics like hospital bed days avoided, prevention enrolments, and digital adoption. So they are reporting on these through their public displays, through their annual reports, through their financial reports, and their meetings with investors and shareholders. NIB's AI productivity gains and contracting model reform show a company-wide approach to innovation. So again, we're not seeing isolated teams focusing on innovation anymore. We're now seeing system-wide and company-wide innovation sprawling through organisations. HCF translated evidence into scaled programs like the GLAD program, Coach, and Treatment at Home that deliver measurable savings and health outcomes. Bupa have made some great strides in the past 12 months, shifting from strategy into execution, scaling their connected care and free telehealth at pace. And HBF now have a great platform with their modern systems and cloud-based infrastructure, giving them a great platform to innovate and move at speed and scale as they need. Okay, so I guess the question now is, so what? So the upshot of all this is that we have a new benchmark for what funds need to be doing in 2025 to succeed both now and into the future. The reality is that those who aren't yet there need to get there quickly or face increasing challenges over the coming decade. And we'll talk about some of those challenges and futures a little bit later in the workshop. But here are 8 essential things that we've seen based on the research that all insurers should be doing right now as part of their armory. Number 1 is that best-in-class treat innovation as a joined-up business system that links strategy, delivery, and outcomes rather than a set of standalone projects. So where we've seen over the last decade funds kind of touching on the sides and experimenting and piloting and trying lots of things, we're now seeing to start to see those things scaled and operating through their business as usual functions. The second is that they deliver clear, quantifiable improvements in affordability through no gap certainty, home-based care, smarter contracting, and operational efficiency. Number 3 is that prevention is delivered at population level with clinically validated programs that measurably reduce risk, delay disease, and avoid hospital use. Number 4, they shift significant care into homes, community settings, and digital channels, reducing bed day reliance and improving access and experience for their members. Number 5 is that digital and data capability functions as critical infrastructure that powers their claims accuracy, personalised engagement, virtual care, and efficient service. So digital is an absolute must as a core infrastructure, no longer as a differentiator. Number 6, they build transparency. They build trust through transparency, simple products, predictable costs, and fast digital service that consistently meet the modern consumer expectations. Number 7, they work with hospitals, clinicians, governments, and digital disruptors to redesign care models, improve efficiency, and deliver sustainable system-wide outcomes. And finally, number 8 is that disciplined innovation is aligned to clear strategy, backed by strong governance and executed with disciplined delivery that translates ideas into measurable results. So that's what insurers need to be doing today to stay afloat. Now we'll take a look at what the world might look like for insurers in 10 years' time and identify some of the must-haves to prepare and succeed in 2035. First, we'll just step back and have a snapshot, take a bit of a look at what Australia might look like, is likely to look like in 2035 if current trends continue, as history has shown, and what government agencies forecast. So number one, there'll be 4.5 million more people living in Australia than currently do. So 32 million people will call Australia home in 2035. 14 million of those will be aged over 50, which is 4 million more than what we have now. 18 million will have a chronic disease, which is 5 or 6 million more whom currently have a chronic disease. 14.5 million Australians will have private health insurance, which is 2 million more than currently have private health insurance. The private health insurance industry will be worth $50 billion, $20 billion more than it is now. There'll be 20 private health insurers, down from 28. So there'll be 8 less insurers fighting for 2 million more customers and $20 billion more in revenue. And my premiums will have gone up almost $4,500 to be well over $10,000 to cover my family each year for private health insurance. So as a result of this different Australia, which is very different to the Australia in 2025, and combined with how funds are investing now and innovating now, here's what the world of private health insurance might look like in just 10 years' time. The major funds are likely to operate as integrated health partners, combining insurance, virtual care, home-based care, diagnostics, prevention, and primary care through a single connected service experience. Hospital at home, virtual consults, short-stay surgery, remote monitoring, and community-based transitional care will be the dominant modes of delivery, reducing national hospital bed demand and reshaping the funding model. No-gap contracting will be near universal for major procedures. Value-based agreements will replace legacy fee-for-service models, and digital claims automation will remove waste and leakage and keep premiums stable and predictable. Chronic disease programs, metabolic health support, cardiac and diabetes screening, genomics, and weight management pathways will be mainstream, with millions of Australians enrolling in long-term prevention plans delivered through insurers rather than hospitals and other services. Insurers that can demonstrate measurable system benefit will work with government on affordability, hospital viability, workforce pressure, and long-term system design, shifting the relationship from adversarial to collaborative. Members will rely on AI-guided navigation that shows costs, quality, wait times, and personalised care pathways in real time, with most simple queries and transactions fully automated and human support reserved for complex, high-value moments. Typical patient journey will combine virtual GP triage, remote diagnostics, at-home treatment, and coordinated handover to specialists, supported by integrated records and shared care plans across the health system. Insurers will play a major role in aged care navigation, transitional care, and community-based management of multi-morbidity, supporting older Australians to remain at home longer and reducing hospital dependency. Number 9, experience will be defined by transparency on gaps, proactive health guidance, flexible products and everyday value, with trust measured through real outcomes, not marketing. And finally, insurers will earn revenue from integrated care, prevention, digital health services, and owned health infrastructure, reducing reliance on premium growth and improving long-term sustainability. So if that's what the world looks like in 10 years, you may be starting to wonder if your organisation is prepared to not only thrive, but to simply compete in this future. And if history is any indicator of the future, it's entirely possible that there will be less insurers in 2035 than there are now. So how do you avoid being one of those who don't survive? Alarmingly, our research conducted across a number of health funds over the past 12 months has highlighted that funds in general are only half ready for the future. The biggest gaps are in technology and digital transformation, where funds are only 25% ready, aging and population health, where they're only a third ready, and staying well, where they're only just over a third ready, or nearly 40% ready.